Welcome to Webisode 19 on Neurobiology of Opioid Use Disorder. I'm Lisa Wheeler. I'm a physician assistant with over 25 years of experience in several specialty areas, including orthopedic and emergency trauma medicine. For the last 6 years, I've been practicing in the areas of addiction medicine and in OTP, as well as OBOT and pain management in private practice setting. We know that opioid use disorder is a neurochemical chronic medical illness that requires long-term treatment. A lack of willpower or moral failing is not neurochemical and is not part of the medical neuroanatomical science behind opioid use disorder. This is a very complex topic, one that is hard to explain to our patients and their families, but we should try. We know that overexpression of the gene transcription factor delta phosphate in the nucleus accumbens plays a crucial role in the development of opioid use disorder by sensitizing drug reward and amplifying compulsive drug-seeking behavior. Overuse of opioids leads to increased delta phosphate expression in the nucleus accumbens. Opioids affect dopamine neurotransmission in the nucleus accumbens via disinhibition of the dopaminergic pathways as a result of inhibiting the GABA-based projections to the ventral tegmental area from the rostromedial tegmental nucleus, which negatively modulates dopamine neurotransmission. This is a common pathway in addiction. Remember that we have natural opioids in our brains called endorphins, and these natural pathways are important to reinforce positive emotional experience like runner's high, love, and laughing. However, other opioids that our patients are using are more potent and powerful than what our human brains can produce. Neuroimaging has shown functional and structural alterations in the brain. Studies have shown that chronic intake of opioids, such as heroin, may cause long-term effects in the orbitofrontal area. This area is essential for regulating reward-related behaviors, emotional responses, and anxiety. Neuroimaging and neuropsychological studies have demonstrated dysregulation of circuits associated with emotion, stress, and high impulsivity. Ligand studies have shown a greater density of mu receptors in parts of the brain in people living with opioid use disorder when compared to controls. While we believe that the use of methadone and buprenorphine can downregulate these receptors after greater than 1 year in treatment and a gradual taper of these medications, there is much variation from patient to patient, and patients may be on these medications longer. Again, this is an important complex topic in opioid use disorder, but one that is critical to understand and explain to treatment teams and patients. If you have any further questions, please feel free to contact your state opioid treatment program. Thank you for watching, and keep up the good work.